The vision behind the PRSB core information standard is that it is the fundamental building block for shared care records. It's part of the journey to interoperability and sharing of effective and clinically safe information between caregivers and patients. The shared care record it's the main PRSB standard, and it's made up of all the essential elements you would need for a person's continuation of care, their whole care journey. So we're looking at the person as the center of the picture, and the core information, if you like, is the circle around which their care should be coordinated. Their information should flow between caregivers and between the patient themselves and their caregiver, and the other way, vice versa.
So Orion Health have been delivering shared care records now for over 10 years. The core information standard was very familiar to us. We've seen a lot of our customers implementing elements of the core information standard, but perhaps doing it in not a structured way. When we saw the core information standard, we thought this is really good. We can now standardise the clinical content within a shared care record for the purpose of making that information available wherever and whenever it's needed across different organisations. We had our weekly sessions and we took a structured approach to the assessment process. Each week we set an agenda to go through the different sections of the core information standard. And we basically, it was a very comprehensive standard, so we need to spend some time on it. We also needed to take work back into our company to do some development in order to ensure we could meet the necessary elements. But it was very delightful working with Annette and the team. We got on very well, we worked very collaboratively. I think it worked well both ways. We learned a lot from Annette and the team around the clinical practice, and I hope they learned a lot from us around how a shared care record operates and behaves. So yeah, we were very happy with the assessment.
Well, I think Ben said a lot about what other vendors should expect, and I like the pun, take a structured approach to going through the core information standard. It is a big standard, but it's essential, and I think, like some of people have said earlier today, you just have to go for it and get into it. And I would say it's very collaborative, as Ben said. We do work together. It's putting the theory of the standard into practice. We've done all the evidence-based, the consultation, so vendors should know that it's a trusted standard, but to put it into practice is a different thing, so we need to work in collaboration with vendors to do that. They've got the practice, they've got the customers on the ground, they can feed back to us what some issues are. So again, we're learning and they're learning, and we hope to make this better, because it has to be all of us together to make interoperability work and to improve the records of patients and the care that better care the patients should get from these new opportunities from IT systems. It's very exciting, but as I say, it does take us all to work together to achieve it.
Yeah, and I think it's going to help to create a common understanding, from different organisations, from different vendors, of what that information set needs to look like. Obviously, we were the pilot. As other vendors look at that standard, we can then start to talk the same language. We can start to talk about what's the social care information that needs to be in the record, what's the mental health information. So I really see it, moving forwards as more vendors adopt it. We can really start to think about what that information is and have a common understanding.